When you make a commitment to do this work, there's no obstacles. You do what it takes. You do whatever it takes to meet the needs of those individuals that have trusted you to help them have a better life. Nothing stops you.
Our organization has been in operation since 1902, and that's not by accident or by luck. That is because we're committed to working really closely within our community and to be listening to them and to be responsive to what their needs are.
Youth were exiting foster care at 18 years old. They came from an environment that was usually a group environment with a lot of support, and then they were asked to leave with nowhere to go. We recognized that what was missing was houses, homes for them to live in. So without any contracts, we put together a campaign to start a program that was unheard of at the time. We're helping youth that may be homeless in the community find services and navigate towards housing, reducing the amount of youth that goes into the adult homeless pipeline.
We know that when we're able to match a trained therapist or a community wellness specialist to work on behaviors with the individual in the schools and get early intervention, we can help to identify what the challenge might be, what the obstacles might be for this youth, and to be able to work individually with them and their family to get them to course correct early on and to get them to kind of pursue their passions and maybe help them to identify what their passions are and to kind of point them in the right direction.
Our job is to get youth and families back together. Some of our youth have bounced around so much that they've been disconnected from their families. A lot of times they've moved to more affordable areas across the country. We'll fly them in, they'll stay at our family cottage. They get a chance to spend the night right there, and their siblings can as well, and stay connected when they see the efforts that we go through to get them back together with their family. They already know this is something different, and they start to engage and buy in. And they could have had some really problematic behaviors, but once we start the family connections, then we start to see a change.
Mobile crisis is able to benefit everyone within the community, regardless of socioeconomic status, regardless of insurance type, and regardless of age. Our aim is to try and stabilize the individual, leveraging natural resources or their natural supports, linking them to services within their community so that they can have some of those ongoing needs met, so that that can potentially insulate them from having a future crisis.
If you care about society, care about what's happening in your neighborhoods, if you know somebody that is struggling with mental health challenges, suicidality, drug addiction, challenged with housing instability, or struggling with poverty, and you don't know how to serve them, Sycamores has done that for 120 years. We're the middleman between you wanting to help and the people that need the help.